We try harder. Bell Beverages, refreshing the nation, and Danex Artin Starwin PLC. That's PLC. So listen, all MTN SIM cards in Ghana must be registered again with only the Ghana card by the 31st of July 2022. That's a few days away though. Yeah, kindly dial *400# hash to check if your registration has successfully been done. All successful registrations would have B Cup yes. If this hasn't been done, dial *404# hash and follow the prompts ASAP. Now, failure to register your MTN SIM will mean that you will not be able to make voice calls, use mobile money services, internet, and all other services linked to your SIM card. Know that the registration is free and you'll not be required to make any payments. Plus, we'll give you 1 gigabyte of data free of charge, or 1 hour talk time valid for 7 days. So get to it. If you're a salaried worker, I'm excited to tell you that you don't need to wait for payday to get paid. You can get paid any day with the Access Bank Payday loan offering by simply dialing *901*11# hash. Yeah, with this unique offer, you can access up to 40% of your net monthly salary before payday to solve pressing needs and still have enough to enjoy on payday. Now, this offer is open to all salaried workers. So if you want to enjoy this and more, switch your salary account to Access Bank today and get paid any day. Remember, it's simple. Just dial *901*11# hash and get your loan in 60 seconds. No documentation required. With Access Bank, any day can be payday. Terms and conditions apply. For more information, you can call toll free 0800 004400 or visit our social media website. Access Bank, more than banking.
Drive time on Joy with Lexis Bill.
Yes, tomorrow, Thursday, 28th of July 2022 is World Hepatitis Day. We've been talking about hepatitis for a couple of weeks, and I'm sure you have enough information about it, or maybe you still have questions. Well, today on our drive chat, Dr. Yao Osafo, CEO of Medicas Hospital, will listen to your questions, your queries, anything that you want clarity on regards to hepatitis. We talked about hepatitis B and C. I don't know why he skipped A. He's here. He would answer himself. Doc, you're welcome. How are you?
I'm good. How have you been this week?
I've been great. It's been a great week so far. I was looking forward to you coming in here, just because we're actually days away from our health and wellness seminar. Yeah?
Absolutely. Kwame, I'm looking forward to it. And good afternoon to all our listeners. I think the health and wellness series seminar comes off when? Monday?
On Monday, 1st of August. Yes.
Right. And that's going to be the maiden edition.
Yeah.
So we're all very excited. Really, really looking forward to it.
For the uninitiated, tell them about it.
Right. So, Kwame, I think from 2020, we have all come to the realization that we can no longer take our health or good health for granted. That was the year COVID hit. And I think for the first time in a generation, we all got to know what a pandemic was or is. And since then, there have been other health challenges, global health challenges. I think recently we all talked about, or we all heard about the Marburg virus.
Yes.
Prior to that, there's been Lassa fever virus. Then there's swine flu.
Chai.
And if you roll back a few years, then there was Ebola.
Oh dear.
All this while, there's still, or we still have the old guard, the cholera, the typhoid fever, the malaria, the tuberculosis, HIV. Again, sneaking in, I think, Kwame, the last time we talked about the 10 causes of death globally, and then in our part of the world, we realized that non-communicable diseases, the cardiovascular diseases, the heart attacks, the strokes, atherosclerosis, the fatty diseases of the blood vessels, and so on and so forth. They are all now creeping into the top 5 causes of mortality. So I think now more than ever, health and the conversation about health has taken center stage. And we need to do a lot to make sure that that health conversation is kept on that front burner, and we keep it there and have a lot more conversations about it. So following on all this, then what does Joy FM do? Well, they come up with this very, very wonderful initiative, which is a health and wellness series, to bring experts, individuals, physicians, other healthcare professionals who are very, very familiar with their topics that they're going to discuss, to come and interact with patrons. So it's more of an interaction. The format is going to be very different because they're going to speak for half of the time and they're going to interact with the audience the other half.
Yeah.
So for this maiden edition, we have 3 expert speakers, distinguished speakers. One is going to speak to us on mental health, which, Kwame, I believe it is one of those areas where we don't pay particular attention, unfortunately, in our part of the world. But Kwame, if I tell you that 1 in 4 of us would experience a mental health challenge at some point in our lives, then you know that it is an area of health that we really, really need to focus. Unfortunately, it's one of those stigmatized areas. So we're going to be talking about a very important topic on Monday, sleep.
Sleep.
Yes. So most people don't know that sleep disorders fall, right in that area of mental health. And if you don't get good sleep over a period of time, it can affect your mental health.
Oh, wow.
Yeah, so Philip, I've cautioned Philip. Philip, if you send him any message at 2 a.m., he will answer. 4 a.m., he will answer.
But what were you also doing up at 2 a.m.?
Oh, that one is my alarm. My alarm went off accident. Kwame, you see the emergency, I'm entitled to be awake.
Okay, I hear you.
Philip has sleep problems. So it's going to be a topic that everybody can relate to.
Yeah.
So we'll talk about sleep. Then we'll also talk about the wellness aspect, of health, those promotive and preventative health issues. Unfortunately, our healthcare system is skewed towards curative health. So we're doing very well when it comes to curative health, but we're not doing so great when it comes to promotive and then preventative health, which I would lump together and call wellness. So we're going to have one of our very distinguished speakers talk to us about nutrition and your family health history.
Okay.
Does your family health history dictate how you should eat, what you should eat, how much of it you should eat, and when to eat? Does your family health history matter? Well, she's going to shed a lot more light on that particular subject. And when we all like food, when we are happy, we eat. When we are sad, we eat. Food is available at funerals, and food is available when we qualify for the World Cup. So it's very important that we know a lot about nutrition. And then I would also talk about a very important aspect of health, hormone related diseases. I'm going to look at a very special gland. I call it a very special gland because it's very small, but it's very, very important to us. It's called the thyroid gland. Okay. So again, it's an area that most people don't know about. So I want to appreciate the management of Joy FM for such a wonderful initiative, and we hope to make it a quarterly event.
Absolutely. I'm looking forward to it already. It looks very good and informative. And if you would want to be there, you can actually let us know. Send us a WhatsApp on 055-111-997. Would want to have you there as well. You can interact with our very august speakers, Dr. Yao Osafo, CEO of Medicas Hospital. Dr. Ruth Owusuenchi is going to speak on mental health.
Yes, she's a psychiatrist.
Yeah. And our dietitian.
Yes.
Ella Seko is going to be on there as well. So we totally can't wait. It's on Monday, 1st of August.
Right. And Kwame, you know that people can join via Zoom.
Yeah.
So this is going to be a global audience, because Joy FM's got this huge global reach. So I know people who are already seeing the adverts, and they've sent me messages from Canada, from the United States, from the United Kingdom, from South Africa, and then from Nigeria. Some of my friends in all these places have picked up the adverts.
Yeah.
And they are asking me about it. So people can join. People can also send in even questions ahead of time.
Good.
So that our speakers can focus on some of these areas. So we will take a lot of questions from patrons.
Monday is the day, so don't miss out. 7 p.m. here on Joy 99.7 FM.
Absolutely.
It's going to be live. Yeah. So for 2 weeks, we've been talking about hepatitis. You shared a lot of information about B and C.
Right.
And you mentioned that there's hepatitis A as well.
Right.
Well, before you actually tell us about it, let me let our friend who's listening know that you can send in any question at all that you have about hepatitis, okay? Whatever you want to find out, the doctor would speak to it, okay? Send us a WhatsApp on 055 1111997, or you can call us on 0302 216541. Today we're having an open clinic, but you would want to shed a little bit more light on it.
Right. So, Kwame, I did mention that the hepatitis viruses, there are the 5 of them, and they follow the alphabet from A, B, C, D, and then E. We focus mainly on the 2, the B and C, because they are the bad ones. They are the ones that are responsible for the majority of the mortality that you get when somebody gets hepatitis. They're also the 2 that can lead to chronic hepatitis infection, which causes long-term damage and destruction to the liver. So that's the focus. But then there is also hepatitis A, which I felt I should mention because its transmission is very, very different. So it also causes inflammation, or it infects the liver, just like the rest. It causes some inflammation in the liver. But Kwame, the mode of transmission is unique in the sense that it is fecal-oral, meaning fecal contamination of food and water. So it's a disease of poor hygiene. Remember when we talked about hepatitis B and hepatitis C, we mentioned bodily fluids for hepatitis B, primarily blood and bodily fluids. But then for hepatitis C, we talked about primarily being blood-borne infection. And so the risk factors were mainly those things that will bring you someone's blood or someone's bodily fluids, such as semen and all of that, into contact with another person. But when it comes to hepatitis A, well, then the key thing is that contaminated food and water with fecal matter of the infected person. Children tend not to get symptoms when it comes to hepatitis A. More of adults who show the symptoms, and the abdominal pain, low-grade fever, diarrhea, vomiting. So, Kwame, when people have diarrhea and vomiting, and then most of the time they'll go to the community pharmacy and then they'll pop some antibiotics. They're guilty of buying Flagyl, which most of the time we mention it's an antibiotic. It won't work against the virus. So most people wouldn't think about hepatitis A or as a medical condition that is characterized by diarrhea, vomiting, abdominal pain. Then you can get yellowing of the eyes as the liver continues to take a hit. And then you can get dark urine and then pale stools if you're not intervention doesn't happen quick enough. The good news is that with hepatitis A, you tend to get lifelong infection. Probably about 98% or 99% of all people who get infected would wipe out the virus and then develop lifelong immunity. Vaccines also exist for hepatitis A. Unlike hepatitis C, I mentioned last week, where unfortunately we don't have a vaccine for hepatitis C, but then we have a vaccine for hepatitis B. So when it comes to hepatitis A, vaccines also exist, but your body tends to provide lifelong immunity.
Okay.
So I just wanted to throw in hepatitis A before we take the questions.
So the takeouts will be how to prevent it, and I think one of the things that stands out is the hygiene. So it is a disease, unfortunately, of poor hygiene, and also in places where accessibility to potable water, it's a problem. And if you look at our country, really, then that is a prototypical society where hepatitis A would be common. So I think if you look at our country, then most people would have been exposed to hepatitis A. Most people wouldn't know it, especially children, because their immune system will fight the virus and tends to wipe it out in about 98 to 99% of all cases. So most people won't get ill. Most people will have a small bout of diarrhea and vomiting, which are baits, which we may attribute to food poisoning.
Which in a way it is you can also look at it that way because the food and water has been contaminated with that. So we would encourage the health or say works and housing, whoever is responsible for making sure that we get water in all communities, potable water in all communities, safe water in all communities. This is a wake-up call for all of them.
Let's get on the phone lines now. You can call us 0302216541. Hello.
Hello, Lexis. Good afternoon.
Good afternoon. What's your name?
Oti Wate from Tema.
Oti, let's hear you.
Yeah, I think 10 years ago, in our church, they come around like hepatitis B, so we have some injection. So I want to ask doctor, after the injection, how many years should I check again another injection? I don't know, it's 10 years.
Right. So, probably what he's talking about, Kwame, is that he got vaccinated against hepatitis B after the test. So if you were born when I was born, then you missed out. At that time, there was no vaccine.
Yeah.
But now, hepatitis B is part of the childhood vaccines that is offered to a lot of children. I think since 2007, it has been part of the expanded program on immunization. So all children born now get that. But for the adults who were born earlier, who didn't have that benefit, then there are a lot of screening programs, and that's one of the things I'm encouraging every adult to do right now. If you screen and you're negative, you get vaccinated as well. Typically, the vaccine will give you a minimum of 20 years, but it can also give you lifetime protection.
Okay.
So lifetime minimum 20 years protection. If you're a healthcare worker, though, then it's very different because when we're exposed to bodily fluids, we're exposed to blood. So it is encouraged that after 10 to 12 years, you get a booster.
Okay. Luther in Tema says, I got tested last Saturday for hepatitis B. The results came out negative, but my problem now is where to get the vaccine.
Right. So the vaccine is not routinely available. I can't say every single, hospital or clinic would have it. What I can say is that we have it available at our facility.
Okay.
You should check any of the major Ghana Health Service centers as well. And then we've got our immunization place at the former Adabraka Polyclinic, for example, is Ghana's major one. But we've got it at Medical's Hospital. So
in Medina,
and then in
yeah.
Mampong.
All right. Hello.
Hello.
Hi, welcome. What's your name?
Amy.
Amy, let's hear you.
Yeah. Please, mine is on the hepatitis B vaccine. Whether if you take it, those children that were given the hep or whatever,
yes,
after 10 years, do they need to be given a booster again or what?
Right, not necessarily. They don't. As we said, we believe that vaccine can give you lifelong protection if you are vaccinated properly. Vaccines are not 100% safe. They are not. So actually, it's not about the safety. Efficacious. They're not 100% efficacious. So not everybody who gets vaccinated against, say, polio or tuberculosis would get protection. So actually, what's supposed to happen is that if we give you the vaccination, ideally we are supposed to check whether or not you've made antibodies at the appropriate titers to the vaccine. And then once that happens, then we believe that it should be lifelong, but at least 20 years is the minimum.
Hello?
Okay, please, I'm not done. No.
Okay, go ahead.
Please go ahead.
And I'd like to know whether the hepatitis B disease, that condition, can you get it if you kiss someone or whatever, sweat, body contact, those sort of things? Can it be transmitted through those media?
Right. So, no. We don't think that just bodily contact, touching somebody, with sweat, through sweat, you would get it. But semen, yes. Vaginal fluid, yes.
Kissing.
Saliva, very low. So the virus is present in there, but its transmissibility through saliva is very, very low.
Okay.
So you do it freely.
I was going to say that after my boy had the hep, and when he got to SHS, we tested he was negative. We went in for the 3 doses again because nobody was there to tell us whether it's a lifelong. Don't take it. nobody was giving us. I went around asking the disease control officers. Nobody was telling me anything. So when we tested and it was negative, we went ahead to take the 3 doses again when he was 15 years.
Right. So, okay. So when it comes to vaccination too, one of the joys about vaccination is that there's nothing like over vaccination.
Okay.
Because we are just exposing you and building your immune system. So I'll use malaria as an example. Kwame, every time you get bitten by mosquitoes and all of that, you get exposed to the parasite and then it strengthens your immune system. So, ma'am, don't worry that he had been vaccinated again, but you should have been given information about the duration of the vaccine in terms of its efficacy. We're supposed to be providing that information as healthcare professionals.
All right, 0302216541. That's our number. You can call us. Can HBV be cured completely? From Sebastian from Winneba.
Right. So when it comes to the hepatitis B, then we talk about treating it. Yes, but there are cure options as well. What we call seroconversion, where you become negative. It is not a common occurrence. Every now and then you would get some individuals seroconverting in quotes being cured. When it comes to hepatitis C, then the therapy options that are available or the treatment objective when it comes to hepatitis C is cure. So there are a lot of treatment options available for hepatitis B right now. Some theoretically can lead to a cure.
Okay. I'm trying to pull up our messages.
Right. So whilst we do that, let me say something about the hepatitis or the issue about the vaccination, because I think our caller was worried about getting it being vaccinated again. When it comes to, for example, polio, every now and then you'd find that they say they're doing mass vaccination, and we're not selective. Public health initiative, they would go around and then they would give it to every child in the community or in schools, and it is helpful. We're exposing you to a weakened form of the virus or certain parts of the virus so that your immune system recognizes it and then develops antibodies against it. So you shouldn't worry if you took the vaccine, after 10 years again, it would strengthen your immune system. I also mentioned that as healthcare professionals, then that is when we should be we get boosters, because the risk from needle stick injuries, accidentally being pricked by a needle at work, we're always in touch with blood. I mean, you think about the midwives when they are conducting deliveries. Think about the surgeons when we're operating, the nurses when you're putting in a cannula or getting intravenous access. So we get in touch or accidentally sometimes, and therefore we get our boosters earlier on. Let
me read this last one from Yogi. He says, what's the meaning of reactive, non-reactive, and positive lab results of a hepatitis A test?
Of a hepatitis A test.
Yeah.
So that's those words, reactive, non-reactive, is just saying yes and no in simple terms. So because we are performing a chemical reaction with the method that we are using in that small device, point of care device, there are some chemical substances in there.
Okay.
And therefore, if you have what we are looking for in your blood, then it reacts with what is on the strip, and then we get a certain reaction which is visible to everybody, and then we'd say reactive. So reactive simply means that it is what we are looking for is present in there.
All right, let's see who's here. Hello.
Hello, good morning. Good evening.
Yes, sir. Welcome. What's your name?
My name is Patrick.
Patrick, talk to us.
Yeah. I want to ask the doctor for an advice over there. I think about 10 years ago, I got tested, and the doctor said hepatitis C positive. And they did some tests, and they took some samples.
Right.
They said they took it to South Africa, did something about it, and they realized that the dosage wasn't so much, and then my immune system can fight it. And ever since then, I have not done anything about it. So I want the doctor to advise me what should I do now. It's over 10 years.
Very good. So our caller just described to us chronic inactive hepatitis B. That is his diagnosis. That's what probably his doctors would have explained to him. Chronic inactive hepatitis B. Meaning he got the infection sometime. His immune system couldn't clear it off completely. 6 months after that initial infection, some virus was still present in his blood. So we'll say you have chronic infection. Then we would have other tests to determine whether or not the viral load. We want to know how many copies you have. Then we will talk about the activity of the virus, whether it's still replicating, multiplying. If it is not multiplying, sometimes it may lie dormant for years and nothing happens. He should get a follow-up every 6 months or every year. He should have a follow-up with his regular GP. He can stop by and then we will be able to do that for him. We'll look at his liver function test and then we'll also look at his viral load.
Okay.
And these will be the markers by which we'll also give advice about care for the liver in particular.
Okay.
Yeah.
Well, that's good. For those who would need more of that, how do they contact you, Doc?
Right. The telephone number is 0501 477 340. 0501 477 340.
That's right. Dr. Yao Safa is the CEO of Medicas Hospital, and I'm happy that you've shed more light on hepatitis. We can close the chapter on it now and celebrate hepatitis tomorrow. Tomorrow is World Hepatitis Day, right?
Absolutely.
Yes. So, but I'll see you on Monday.